Hey everyone, I'm Scotty from Scotty RNY, and this is my very first video about my weight loss surgery and the journey I'm going to go through. So, let me start off that weight loss surgery maybe not be for everybody, but I know it's for me and my time is right. One of the reasons why I'm doing this video is because there's not a whole lot of guys out there that do videos. There's a lot of women, there's a few guys, but I want this to be for guys, for women, for everybody, and just for everybody to get their perspective of how it's going to go for me. Right now, I am my first day of my pre-op Optifast, and I'll get into that just a little bit. My surgery is going to be July 7th, 2015, and so I'm going to be having Roux-en-y. If you're watching this video, I'm sure you probably know what Roux-en-y stands for. If not, we can get into that another one. But again, this is just my introduction video, if you want to say. So, I'm from Ontario, Canada, and here in Ontario, we have the Ontario Bariatric Network. And the way that works is you go through your family doctor, requesting, or they might tell you you need to have bariatric surgery, and then they make the referral to the Ontario Bariatric Network, and from there, then they make a referral to the closest clinic to you. Sound right? Sounds right. Me, I'm 45 years old, 6'2", and I weigh a lot, a whole lot. My BP is normal, my cholesterol is normal, I have sleep apnea. Everything else about me is quote-unquote normal. I've been heavy all my life. I was born overweight. I've tried many diets and lifestyle changes. Some were good, some were bad, but unfortunately something happens in life that makes me want to eat again, and then I go off everything and gain the weight again. So also with the weight loss surgery, you really have to know that you need to be mentally prepared. It's not just a jump right into it thing. If you're not mentally prepared to do this, it's not going to work for you. For me, in my time, in my life right now, I am mentally prepared. I suffered a back injury in 2012, in the fall of 2012, which has really slowed down my mobility. My right quadricep, I only have 40% use of that. And the doctor said that if I get up to 60% someday, that would be great, but I will still have some kind of impairment for the rest of my life. And I had two doctors of two different disciplines both suggest me having weight loss surgery to help get the weight off of me, because my mobility will be so limited that it'll be hard to lose weight regularly. So I kind of took that into perspective, and this was in 2013 that this was recommended. And I didn't want to rush into it. I thought, well, let me do some research, let me do another diet again and lifestyle change and see if that makes a difference. So I tried all that, and I did a lot of research, watching YouTube videos just like you are right now. And I come to find out that in 2014, I said, you know what, I'm ready to do this. So I went to my doctor, my family doctor, and I said, can you make a referral for me? So she made a referral and got the ball rolling from there. After the referral, then I got a package in the mail, which I had to fill out a whole bunch of questions, your life growing up, all this, that, and the other thing. And then I had an orientation. The referral went out in August from my family doctor, and I had an orientation in October. It was about a 3-hour orientation. It was a group orientation, so we talked to a dietitian and a social worker and a nurse practitioner, and they told us everything what to expect afterwards. And one thing that the social worker said, you're going to hear from a lot of people is, oh, you're taking the easy way out. And like he said, this will not be the easy way out. He said it can be the complete opposite of taking the easy way out. From what your lifestyle change is going to be after surgery, it's no easy peasy at all. The dietitian said that because of the type of surgery, the Roux-en-y, where it will bypass your upper part of your intestine, the duodenum, you're going to be deficient with vitamins. So that means you're going to be on vitamins for the rest of your life. those are all things that you're going to have to consider and going to have to do. I'm ready to do it. What else? I have cheat sheets here, by the way. Also in the orientation, the social worker said, you need to have a support system. Friends, family, Facebook groups, Pinterest groups, whatever. Some kind of support system, because trying to do this alone, will be really hard. For me, I have friends and family, and I have some online support groups that are great because they're very knowledgeable. A lot of people have been through all this already, so I can ask them questions. They're always willing to help. And that's what I want to do too down the road, is I want to be able to help other people with my experiences and let them know what I've gone through, and just to kind of guide them as well, just to give them the insight. What else? We talked about proper nutrition in the orientation as well, and about how portion sizes are going to be different, and protein is going to be your main priority. Also, the size of what your pouch, as they call it, after the surgery will be like. Size of an egg, about 2 ounces is what you're going to have for a stomach afterwards. So that's not a whole lot. So that means you're not going to be intaking a whole lot at one time. So you need to find protein too. So a lot of people recommend that you'll need to take a protein shake afterwards, because you're not going to be able to eat enough chicken or beef or whatever to get your protein in. So you'll be drinking protein shakes too for quite some time. For me, I've been taking protein shakes now for a couple of months. I went to Costco, bought one of their big protein powders. So I've been getting used to that and going into that already. And I'm quite comfortable with it, and it's really good tasting actually, so the chocolate one. After the orientation, met with the nurse practitioner a couple of months later. We talked about your history, your physical history, and talked about the any ulcers that you might have or any other conditions that you've had. And for me, I've never had any ulcers. I've been really good, throughout my life, medical wise. So all I needed to have was blood work done, which they're very good on doing a lot of blood work, and an abdominal ultrasound, just to make sure that the size of your liver. They have to measure the size of your liver for that. I had just had a sleep apnea test done the week prior to the orientation, so those results went right into my package, and I didn't have to wait for that to happen throughout. After the nurse practitioner, another couple of weeks, I had a meeting with the social worker and with the dietitian one-on-one. And the dietitian just kind of reiterated again, everything that you're going to go through food-wise, what you need to take vitamin-wise, things like that. The social worker was a little bit more in-depth, tell me about your life, how's everything, tell me about your home life now, how did you grow up, all that before. And want to make sure, again, that you're mentally prepared for this, because it's going to be one of the biggest changes of your life. So I went through all that, and everything was fine. I had blood work done. My blood work came back. It was a little bit low on the iron and a little bit low on the B12. So the dietitian said you need to take your B12 and take a multivitamin with iron in it, and that will help everything for right now. Everything else was fine. So I asked her, so what are you going to need for vitamins after the surgery? And I was told B12, calcium citrate, vitamin D, and a multivitamin. So I figured, why wait until after surgery? If I already have a bit of deficiencies now, why don't I start now? So I started taking all my vitamins earlier, a couple of months ago, and I think it's great because I had another set of blood work done a couple months later and didn't have any issues. And again, this is going to get me ready for after surgery, when you have to start taking all these vitamin pills. Let's see, what else have we done? Oh, I've done blood work, I have a cheat sheet, and let's see. So we had a group meeting in April. It was called a pre-op class, and again, it was pretty much the same thing as the orientation. Talked about this, talked about that, what to expect, what not to expect. The social worker said, there's different things that you might have to adjust to after surgery, such as addictions. Some people get addicted to alcohol because you don't have a stomach anymore, really, and the alcohol just goes right to your brain. So you're getting drunk a lot faster. So that it can be common for some people is the alcohol addiction. Other people get addicted to working out and the way they look like that, and they kind of take it to an extreme. So again, there's exercising is good, right? By all means, and I'm exercising already right now. But he said sometimes it can be a little too much. So again, if somebody says something to you about it, don't take it the wrong way. Maybe they're saying it because they're concerned about you. Other things that might happen is people will say, well, why did you lose so much weight so fast? Are you ready to tell people publicly that you've had weight loss surgery? And are you ready for what they might say and how they're going to judge you afterwards? Because not everybody thinks it's a great idea. Also, too, for some of the people out there that, have a spouse, sometimes the spouse can have problems with all the compliments that you can be getting. Oh, you look so good now, you've lost so much weight, and that can have an effect on relationships as well. And even yourself, how you can accept all those compliments that you'll be getting down the road. Not just the negative stuff, but the compliments too. Sometimes that can be really hard to take those compliments day after day because you don't believe those people. That's what I'm told. And I think that's going to happen. But again, I'm pretty much mentally ready for it. And we'll go from there. I went to meet the Dr. Hagen at the Humber River Regional Hospital in Toronto. He's going to be doing my surgery. I had a pre-op appointment with him in April. We just discussed, what they're going to do, how are things going with me right now, and that was pretty much basically it. After that, I got my appointment. My surgery date is July 7th, 2015. And here in Ontario, anyways, the way they do it, the bariatric clinics, is what you have to shrink your liver enough to be able to, for the doctors to get in there and move it around properly to get out your stomach. The way they do that is they make you go on a liquid diet for X number of weeks before your surgery. And the X number is depending on how much you weigh. For me, I have to do 3 weeks of this liquid diet, and it's called Optifast. Optifast 900. Again, Optifast 900. 4 of those packets a day, that's chocolate flavor, mixed with water. And it's a protein drink and a bunch of vitamins and all that included. Each packet is 225 calories, so 4 of them is 900 a day, and that's all you have. Now, some doctors are different than others in what they allow you to have with it. For this hospital, they allow you to have up to 2 cups of greens per day to go along with this. Cucumbers, lettuce, whatever else is green, vegetable-wise. So I haven't tried that yet with any vegetables. I'm just going to go as long as I can with just the liquid. And so far so good, because like I said, I've already started the protein shakes before, and I've really cut down everything for the last couple of months. So for me, it's not like going from a big full eating a lot of meals a day all of a sudden to a shake 4 times a day. I've been cutting down everything a little bit at a time. And some people will say, well, if you're doing that now, why can't you just keep doing that, without having surgery? Which was brought up, by some friends of mine, but like the doctors had said, even though with weight loss surgery, you will gain a little bit of that weight back, and that's normal and common. But you're going to lose the weight a lot faster with the weight loss surgery, is what I needed. And with my mobility issue because of my back injury, I can't lose weight fast enough. And even though you're on weight loss surgery, you're going to have a stall, you're going to plateau for a while, whatnot. But again, you've lost enough weight, or a lot of weight anyways, usually when you plateau, and you'll overcome it. Plateauing without weight loss surgery will be even harder for me to lose more weight, because I can reduce my calories down a lot, but it's the exercise that I will need to do afterwards. So again, the weight loss surgery is a lot of weight lost at one time and quicker, but in the end result for me, that's what's better. And you have to know for you, what is the reason for you? Is it a medical reason? To heart problems, diabetes? I don't even have diabetes. Is it just other issues like me with mobility issues and, not going to be able to lose the weight? If you know what your reason is and you're good with that, please keep researching and, do the best, what's best for you. So I'm just started this drink today and it tastes yucky. The protein powder from Costco is so much better. It's smooth, there's no chalkiness, it's a high quality. This Optifast is yucky. Now they say you can doctor it up and you can add like a crystal light to it or a lot of ice cubes and make it in a blender with a magic bullet thing and all that, and I haven't gone that far yet. I'm just making sure the water is cold and try and do the best that I can to dissolve it up in my shaker and give her back. So I've started that today, and what I want to do is do another video in a week's time and let you know how I'm doing from there, and we'll carry on from there. So what else am I going to talk about here? I've talked about that. So realistically, if it's for you, you'll know it. Your friends will tell you, your family will tell you, your doctors will tell you, but it's got to come from you as well. For me, I'm ready for it, and this is why I'm doing it. The Roux-en-y is the surgery I'm having, weight loss surgery, bariatric surgery, whatever you want to call it. And the reason why it's Roux-en-y, again, here in Ontario, a lot of the doctors will say that depending on your weight, if they feel that, and your medical condition as well, if you have diabetes or real bad heart problems or something like that, they feel that you need to lose a lot of weight faster, so they'll tell you to have the Roux-en-y. Other people that may not be so big and may not have any medical complications, they'll say, well, you can have a different type of surgery, but this is the Roux-en-y, and this is what's for me. If I missed something, please let me know. If you have any questions, comments, or concerns, again, leave a comment in the box down below. And if you can subscribe to this, that would be great too, because I want to get my name out there so that everybody can have a chance of seeing my video. Thanks for your time today, and we'll see you again in a week. Bye-bye.